My name is Dr. Carlos Alejandro Garcia. I am a graduate at the University of St. Augustine in Austin, Texas. I graduated this past April 2024, and this is my first month as working as a physical therapist. For many years, I was a swimmer, and one day, right before a state competition, I had actually injured both of my shoulders. And so I ended up going through the rehab process through physical therapy, and while it was a bit of a grueling process because there was a lot of pain throughout, they managed to get me back in top form, and I was able to compete in that state competition. And so the process that I saw and the compassion that I saw from the physical therapist really inspired me to become one myself, and that's how I ended up here today. Well, physical therapists really try and treat the entire body. It's not just the muscles and bones, but we also try and treat, the emotional, the psychological, everything. But common conditions we tend to see as physical therapists usually involve musculoskeletal or even neuromuscular. So we can even see patients who are having low back pain, shoulder pain, lower extremity pain, patients who've had strokes. They tend to lose function of the arms or even the legs, and so that's something that we can definitely help with as well. Well, the big part about injury prevention is the education. Sometimes people don't know that certain actions can lead to an injury. So sometimes it can be either just bad ergonomics or bad mechanics. For example, a person who is working long hours in an office tend to have a very slouched posture, and that can lead to a lot of pain in the neck, decreased strength in the shoulders. So what we try and do is educate and try and reintroduce movement into the body that they have been lacking, so that way they can no longer have those kind of issues going forward. Well, physical therapy involves a lot of rehabbing lost function, and that can involve lost function in terms of not being able to move certain degrees, or maybe not being able to move an arm in a certain way as compared to other rehab. Excuse me. And our goal is to get patients back to how they were before an injury or a certain kind of impairment that led them to come to us. So a typical session with a patient, usually they'll either be referred to us by their primary care doctor, and there we'll be in charge of their evaluation. We'll get some objective measurements as well as a history as to what happened with them, so we can get a better idea on how to help them. And from there, we'll find out what is going on, explain it to them, and tell them how we're gonna go going forward. From there, they'll receive treatment from either myself, the physical therapist, or our team, the therapy assistants or the techs, to help them with various exercises to rehabilitate certain parts in the body that they may be lacking strength or range of motion in. And we can also do other techniques to help them out with pain and other things like that. Well, every individual is different. Every person is going to come with a different problem or an impairment. And we always try and, I would say, customize a plan of care for them that they would like to see. Let me repeat that one more time. Okay. Can you repeat that question?
How do you customize treatment plans for each individual?
So every person, every individual that comes into the clinic is going to have different problems that we're going to try and rehabilitate them for, whether it's due to work or sports. Someone who's working in construction may have certain restrictions when it comes to certain movements, so we'll try and replicate some exercises that mimic or reproduce those same movements, and then try and get them back into those same working conditions, as compared to an athlete who may be having trouble throwing a ball, we'll try and, rehabilitate certain muscles that are in charge of throwing the ball, if that makes sense. So every patient that comes into the clinic will be different, and we'll try and customize a plan for each of them. So effective techniques that I use in my practice, I am very big on manual therapy. It gives me the ability to really work on the joints, because sometimes the joints aren't moving smoothly or moving too much. And so with manual therapy, I can not only target just the pain, but I can also help alleviate any kind of restrictions in that joint. Other things that we can use are things like dry needling, which can target the muscle. If there's any kind of tightness or any pain going on there, dry needling can go in there and hopefully alleviate some of those symptoms as well. So those are some of the things that I use in practice. One of the things that will help with long-term wellness is education. We always want to educate patients to try and stay active, never try and stay static. The American Heart Association actually recommends 30 minutes of exercise per day, or a total of 150 minutes of exercise a week. So this just emphasizes the importance of movement. And by educating patients to constantly move, at least for 30 minutes a day, will more than likely prevent some long-term problems that they may see in the future. One of the most rewarding cases that I've seen, or that I worked with as a therapist, was actually when I was still a student. I worked with a patient who was actually a retired veteran, and she had come to the clinic with a lot of back pain. And so when I first evaluated her, her main goal was just to get back and be able to do the things that she was doing before. And she also had grandchildren she would like to, be able to participate in activities with. In fact, they had a planned trip to Disney World with her grandchildren. So she really wanted to be able to walk long distances with her grandchildren, be able to play with them and those things like that. So I was able to rehabilitate her for the next 2 months, and we saw a lot of progress. The pain had gone down. We were able to address some of the functions that she was lacking in, and before I knew it, that she was completely fine by the end of therapy. And then she sent me pictures actually of her trip to Disneyland, and that just showed me that not only was I able to help her, but that she was able to achieve the goals that she was looking to complete. So that was one of the most rewarding cases that I worked on. So some challenges in my career that I've seen so far is not being able to help a patient achieve their goals. And as a result, most of those patients end up not coming back to therapy or not believing in the capabilities that physical therapy can have for them. And so what I want to do going forward, or what I am doing going forward, is constantly looking at the best available evidence that there is, and constantly trying out new things that are supported by that evidence in order to better help my patients going forward.
Moving over to advice and tips. What tips would you give to someone recovering from an injury at home?
The best thing that a person can do when they're recovering at home is, for one, is to continue doing the home exercise program that we have given to them. And the second is to try to move as much as possible within the available range that they have. And what I mean by that is that if you get to a certain point and you feel too much pain, try to do a little bit less, but try to continue to moving into that range. You never want to stay static, because the muscles adapt to the stresses that we put. So if you're not constantly moving, it will be a lot harder to recover from the injury that they have. Well, the best thing to do to stay active and healthy between physical therapy sessions could be a variety of things. As I mentioned before, movement is key and staying active is key. And there are a variety of things that we can find in our community. There are local gyms and YMCAs that can cater to any kind of individual of any age. Aquatic therapy is known to be a great exercise not only for the muscles and bones, but also for the heart and the lungs. And it also has great benefits for patients who have issues with their joints as well. And so finding these places and participating in them and participating in the community is a very healthy way of staying active and staying engaged with the environment and with the community itself.
Alright, what changes or advancements do you see happening in physical therapy in the upcoming years?
So from what I've seen throughout my career, as not only as a student but as well as a physical therapist, is that there are a lot of advancements in telehealth. And what telehealth is being able to provide physical therapy but through online services, whether it's through a computer, a phone, anything that has any kind of video capabilities. Will be able to communicate with patients from the safety of their home or from the comfort of their home. And from what I've even seen is that there's actual some hospitals or even some clinics that have basically a rolling video camera that can follow a patient. I don't know if it's being practiced around in all the United States, but that's something I saw in one clinic where they're able to engage with the patient, follow with them, and still give them instructions throughout, almost as if they were getting therapy at the clinic itself. So that's something I can definitely see as a future of physical therapy. Well, the best thing to do is to ask yourself, is this something that's normal? If for whatever reason one day you find out that you're having less motion or maybe pain in a certain area that you know that is not normal, that has lasted for several days without any improvement, then you may want to consider seeing a physical therapist. If it's something like a fever or anything that may be a little bit more systemic in nature, and by systemic I mean more like kind of like a virus or an infection, then definitely see your primary care doctor. But if it's more muscle, bone, nerve, and something that hasn't improved or is decreasing your ability to do things, then that's something us physical therapists can help you try and address. Here we have not only a physical therapy clinic, but also a physician clinic as well, where they can even refer you to physical therapy. You can even give us a call with the number that you can find on our website, and you can even shoot us an email to any of the physical therapists if you have any questions.